Hello, my name is Mandy Sellers. I was born on the 20th of February 1975, and at my birth there was something visibly different about my appearance. Both my legs and feet were extremely large, probably 4 or 5 times larger than the average baby. Despite seeing various specialists over the years, such as vascular, plastic surgeons, and orthopaedic surgeons, my health remained pretty good. However, my legs continued to grow during this time, with still no firm diagnosis other than lymphedema. I was pretty much left to it by doctors as they didn't really have any idea of how they could help. My parents were offered the option of amputating both of my legs when I was 7, but they were told I was unlikely to survive the operation, so they refused. I enjoyed school and college despite the physical challenges it brought, and managed to achieve enough qualifications that gave me the chance to attend university, a first for our family. However, even though academically I was able to be on a par with my fellow students, physically I was struggling to enjoy my independence. The time had come where I required some help, so I deferred my course and came home to go ahead with what I felt was the right solution at the time: liposuction on my left leg, which was always the most cumbersome. The result was a removal of 6 pounds of excess fat, but unfortunately, due to inactivity after the operation, my leg grew rapidly and my weight increased by a further 20 pounds. After returning to studying various subjects, I was able to attend university again and gained a degree in psychology. Following this, I began studying counselling and was 2 years into the course when I woke up one morning with both my legs tingling. I didn't think much of it, assuming that I slept strangely. However, getting out of the bath, the tingling changed to a low-level pain, but my legs began to feel heavier than usual, and I knew that something wasn't right. I managed to get to my front door to unlock this as I stumbled back to my bed, where the pain intensified, but at the same time I was losing the ability to move my legs. I was taken to A&E, where I spent 6 or so hours. I was given anti-inflammatory injections and pain relief medication, but every doctor I saw didn't know what was happening. I spent several weeks in hospital under a neurologist who performed several tests, but nothing showed up. Around 6 weeks of lying in a hospital bed, the feeling spontaneously began to return in my legs, and I have now what I would say is around 80% of feeling. It wasn't until 15 or so years later that I was told that at that time I'd actually suffered a spinal stroke. But I was also discovered to have a blood disorder called protein S deficiency, which now means that I take warfarin for the rest of my life. So once the feeling returned, I learned to walk again, which I did, and got back on my counselling course and graduated as a counsellor. However, my mobility was beginning to suffer, and I was finding my life becoming affected by the increasing weight in my legs. So the time had come to begin my journey into researching my condition. My initial search saw me seeing various doctors at numerous hospitals, but this wasn't fruitful, and I was stuck at where to turn to next, which I'm sure many of those living with a rare condition face many times. My search, frustratingly, was again put on hold when I was admitted to hospital, this time for 5 months, developing blood infections, kidney and stomach problems, urine infections, severe anemia, MRSA, and foot drop. Again, I had to learn to walk. It took a while, but I did get there in the end. But walking was becoming increasingly difficult and painful due to arthritis and my right hip dislocating more frequently. It was during this time that I met Tracy Whitewood-Neal, who's the founder of the Proteus Syndrome Foundation in the UK. She put me in touch with Dr. Les Biesecker from America, who upon meeting me suggested it was possible that I had Proteus syndrome. Not long after this, my life took an unexpected turn when some fundraising led to my appearance in local newspapers. I was then contacted by a TV production company who wanted to make a documentary about my life, but also my search for definitive diagnosis. This led me to see geneticist Dr. Sue Hewson in Manchester. But frustratingly, my search was again put on hold in 2010, shortly after meeting Dr. Hewson, when I developed blood poisoning in a long-standing pressure sore and needed an emergency amputation of my left leg. This was a scary time for both myself and my surgeon, because he'd never performed this surgery on someone with such a large vascular and blood vessel system, but he saved my life. In 2012, following a referral from Dr. Hewson, I was seen by Professor Rob Semple and Dr. Vicky Parker at Addenbrooke's Hospital in Cambridge. Following biopsies taken from my leg, which is an affected area, and my arm, which isn't infected, DNA sequencing was performed to compare these cells. After a few months, the results came in. They said, "We found your gene. We know what causes your condition. You have a single letter mutation in your PIK3CA gene." In the following years, this mutation has been named PROS, PIK3CA related overgrowth spectrum, which is essentially an umbrella term for a number of conditions that are caused by a mutation in the PIK3CA gene. Some people within this umbrella will have a more definitive diagnosis, such as Clove syndrome or FIL. But for me, I don't fit into any of these and just have a general diagnosis of PROS. This news was so huge that I didn't think it could be topped, but in mid-2012, it was. They said, "We believe we found medication that could possibly stop your overgrowth and could potentially shrink your legs." This drug was Sirolimus, which is more commonly used as an anti-rejection drug for those who have had kidney transplants. They felt it would work for me as it targets the growth pathway where my mutated gene is found, thus blocking the signal getting through to my constantly switched on gene. I was asked to go away and think about this, but really what was there to think about? I hadn't been given any other options, and I knew if something wasn't done soon, then my fear that by my 40th birthday, I would become bedbound could become a reality. So there was never any question in my mind about whether I was going to try Sirolimus or not. So my journey with Sirolimus began. Despite some initial fears of would it work, wouldn't it work, would I maybe develop side effects that would mean I'd have to stop taking the medication, everything settled down pretty well. I remember that none of us were expecting much in the way of results during my next appointment, but the results were nothing short of amazing. In the space of only 3 months, my legs had stopped growing and even shrunk, and I had lost 10 kilograms. Around the beginning of 2018, I'd lost nearly 32 kilograms in weight, and this had been mainly from my lower limbs. Shortly after, I noticed that my weight had become static, and in the following months, I was starting to put a little weight back on again. I also had recurring pressure sores that just would not heal. I was reluctant to consider stopping the drug. I was prepared to even up the dose just to see what would happen. However, it was an infected pressure sore that I had for 13 years that had led to my amputation, so really I couldn't take that risk again. However, stopping Sirolimus led to numerous questions. Once healed, do I start Sirolimus again at a higher dose and maybe increase the risk of further sores? Or do I look for an alternative? Or not take anything and let my body become used to the lack of Sirolimus and then try it again once I'd had a break? At this time, I did speak to other people who had been in a similar situation, and every one of them said how even after a break, Sirolimus wasn't as effective as it had been the first time round. This felt like the end of the road, and the fear definitely set in. All I could do was hope that with my mutation being involved in cancer, then drugs research was always going to be not too far away, and this could hopefully trickle down to someone like myself. But realistically, how long could that take? In recent years, there's been a lot of talk about the new drug called alpelisib. This is a drug that actually targets the PIK3CA gene and not just the general growth pathway. This drug is currently being used with breast cancer patients with some amazing results, and also trials in other countries using alpelisib on PROS patients has also seen some great results. However, it's important to be realistic, as there isn't a one-size-fits-all when it comes to treating PROS. As 2021 started, I've seen a marked difference in my ability to mobilise, and even tasks that were relatively, if previously time-consuming, such as getting dressed, is now a real struggle. Unfortunately, this time, the doctors that I'd been seeing had moved on to different areas of working or different countries, so couldn't clinically help me. But I'm lucky to still be in touch with Professor Semple, who is always kind enough to offer support and suggestions. But this did feel like a lonely place to be, with PROS not being a condition many doctors know much about. It made me realise just how lucky I was to have Professor Semple and Dr. Parker for all those years previously. But in order for me to be considered for a Pellicip on compassionate use, I needed a doctor in England who could apply for this. This has led me to connect with a consultant oncologist at Christie's in Manchester. However, even though he knows about the PIK3CA mutation from a cancer point of view, he doesn't know anything about PROS. So I feel like I'm starting from scratch again, which is a very frustrating feeling, and it feels like this is a constant theme when you're someone living with a rare condition. But on the flip side of this coin is that I'm able to educate another doctor about PROS from a patient's perspective, which is always a positive thing. The application process took around 7 months, but I've been finally given the go-ahead to try a Pellicip for a year. But tests are needed before it can be administered, but I'm hopeful and can't wait to get started. I just hope that this process starts soon, as I know the longer I wait, the more immobile I'm becoming. And also the more my mental health is getting affected by what feels like my life being slowly taken away from me. So as they say, the story is to be continued. So coming up next is a compilation of stories looking at the day-to-day life of living with PROS from those within our PROS community.